The title of this study is Clinical Significance of Gross Extrathyroidal Extension to Strap Muscles in Papillary Thyroid Carcinoma by Propensity Score Matching Study. The 8th edition of the AJCC-UICC TNM staging system has downstaged many patients. Minimal ET was excluded from the T3 classification, and gross ET to strap muscles alone is now classified as a T3B tumor. However, the gETE guidelines still consider minimal ET as an intermediate risk and gross ET as a high risk of recurrence. The role of minimal ET and gross ET as risk factors for recurrence remains controversial, but most studies were conducted by retrospective design and had selection bias. Therefore, we aim to compare two groups by propensity score matching analysis and reduce the bias. We retrospectively reviewed 4,452 patients with PTC who underwent thyroid surgery from March 2008 to June 2014 at St. Mary's Hospital, Seoul, Korea. Postoperative care and follow-up were performed according to the ATA management guidelines. Propensity score matching analysis was performed by individual patients' propensity scores calculated using logistic regression analysis. Patients with minimal ET were matched to those with gross ET at 1:1 ratio. First, these are results before propensity score matching. This table shows comparison among three groups: no ET, minimal ET, and gross ET. In the last column, aggressive characteristics are significantly higher in gross ET than minimal ET. However, there was no significant difference between minimal ET and gross ET in the recurrence rate. The following table shows univariate and multivariate analysis of risk factors for recurrence before matching. It can be seen that neither minimal nor gross ET had a significant effect on recurrence. In the disease-free survival curve before matching, both minimal and gross ET had lower disease-free survival compared with no ET group, but there was no difference between the minimal and gross ET groups. From now on, these are the results of analysis after propensity score matching. After matching, minimal ET and gross ET were matched 1:1 with 213 people each. There was no difference in clinical pathological characteristics between the two groups, and there was no significant difference in recurrence rate either. After matching, as a result of multivariate analysis of risk factors for recurrence, neither minimal ET nor gross ET are independent risk factors, and there is no significant difference between the two groups. After matching, there was no difference between the minimal ET and gross ET groups in the disease-free survival curve. In summary, first, both minimal ET and gross ET were not independent risk factors for recurrence in PTC. Second, there were no difference between minimal ET and gross ET for the risk of recurrence in PTC. Lastly, gross ET to only strap muscles might be downstaged as same risk with minimal ET. Thank you for listening.